Is my doctor's office the future of medicine? Amazon seems to think so. Hi there, everyone. It's Jeff, and this is Plain English lesson number 494. JR is the producer, and all the content for this lesson is already up on the website. Now listen, we are ticking up slowly, one by one, toward 500. I'm starting to get excited for number 500. It's in less than 3 weeks. We have a lot planned, and your free ticket to all the celebrations is waiting for you at plainenglish.com/500. So go there, plainenglish.com/500, to find out how you can be part of the celebration. But we're not going to let that distract us from the important business of English every Monday and Thursday. On today's lesson, Amazon has just bought a popular network of doctors' offices in the United States. It's called One Medical, and it has been my doctor's office for about 7 years. I'll tell you what's so special about One Medical and why Amazon, an online retailer, might be interested. The expression today is time will tell, and we have a quote of the week. Let's dive in. Very few things frustrate Americans like the experience of visiting a doctor. In a world of apps, instant communication, and personalized service, the doctor's office seems like a portal back in time. If you want to see the doctor, you have to go to the office. If you want to get a prescription, you have to see the doctor in person and then go to a pharmacy. If you have questions later, you're welcome to make a follow-up appointment, but emailing a doctor or calling with questions is not encouraged. You might have to wait a few days or a week for an appointment. In large part, this is due to the unnecessarily complex system of insurance. We can't blame doctors and hospitals for this. Doctors don't design the system. They just have to work with it. But one company thought it could do the impossible: work within the current thicket of government regulations and insurance rules, but also give good service on a modern platform that mimics the modern experience we have in the other parts of our lives. Shouldn't going to the doctor be a pleasant experience, like getting an iPhone fixed at an Apple store? I first heard about One Medical when I was living in New York in 2015. I didn't go to the doctor much, I still don't, but I at least wanted a primary care provider. I searched for the best doctor's offices and somehow landed on One Medical. Now, patients of One Medical have to pay about $200 per year over and above any treatment if they want to be a patient at One Medical. However, in return, we get better service and better technology than a traditional doctor's office provides. One Medical has offices. They now have 200 across the US, concentrated in large cities and suburbs. But they blend the in-office experience with technology to provide the right kind of service in the right way at the right time. The app lets patients schedule in-office appointments, but it also delivers remote care when needed. For example, not every ailment requires an in-office visit. If a quick remote visit can get the job done, then patients can see a physician via the app 24/7. After an in-office visit, patients can send secure messages online with follow-up questions. Let me give you an example. Imagine it's Saturday morning and your arm starts to itch. You think nothing of it, but by 5:01 on Saturday afternoon, it's really starting to bother you. Doctors' offices are closed on Sundays. With most offices, you wouldn't be able to even call for an appointment until Monday morning. With One Medical's hybrid model, things are different. You can chat with a doctor on the app after hours. If the doctor has questions, you can send photos or do a quick video call. If a simple prescription would help, the doctor would send the prescription to the nearest pharmacy and you can get it on that Saturday night. If you still want a follow-up appointment, you can schedule that on the app just in case you need it. And if you need to refill a prescription, you can do that by messaging instead of going into the office for a face-to-face visit. This hybrid model, using technology, can improve the experience of seeing a doctor. Why should women, or now men, have to visit a doctor in person to get or refill contraception? If you have typical cold and cough symptoms, why should you risk infecting everyone else to go into the office? Why should you have to show up at an office to refill a basic prescription? Now, I'm not saying that no other doctor's offices or hospitals practice telehealth. They do. And I'm not saying that One Medical is the only network to offer good service. There are others. But I am saying that One Medical has nailed the experience. The app is well designed, easy to use, and effective. The people who staff the messaging service and the doctors who do remote visits are patient-centric, and the interactions just work. And they have also been able to grow and expand, proving that they can give good service to a lot of patients, not just a handful. The offices reflect the same values. They're well designed, they're comfortable, and the people who work there are friendly and customer focused. How was this such a well-kept secret, I wondered, back in New York all those years ago? Well, it's not a secret anymore. One Medical now has over 200 offices and serves almost 1 million patients. And last month, Amazon agreed to buy the company for almost $4 billion. Immediately, patient advocates cried foul, assuming Amazon would use medical data for nefarious purposes. That would be illegal, but a lot of One Medical patients are wary. Amazon says it will use the technology and expertise of One Medical to improve healthcare services for more people. It could use the technology and expertise to bring healthcare to remote areas with few hospitals. It could integrate a pharmacy into the existing One Medical subscription, so it's easier and faster to get prescriptions. It could even put mini clinics in Amazon's existing grocery stores. Time will tell, but the secret is out. Mark your calendars. JR and I have scheduled the official 500th lesson celebration for the morning of September 3rd, and you are invited. That's a Saturday, September 3rd. It's going to be at 9 o'clock in the morning, New York time. So that's morning in the Americas, afternoon in Europe, evening in Asia. Everyone can be a part of it. We're going to do a live stream on Facebook and Instagram. And on that stream, you'll get to see me record the 500th lesson. JR will be here. You will see us both. JR will be on the stream with me. We will reveal the winners of the giveaway, and we will have a champagne toast on video to all of you. So yes, it will be the middle of the morning here, but you have my permission to join us in a champagne toast or wine or beer or coffee or tea, your beverage of choice. But I'd love for you to join us for the toast on Facebook and Instagram. Now that's a little over 2 weeks from now. So get ready, mark your calendars, and connect with us on Facebook and Instagram. I'm making it really easy for you. Just connect with us at plainenglish.com/500. You can find our Facebook and Instagram links on there, and then join us on Facebook and Instagram live stream on September 3rd. This was a long lesson, so let's do an easy expression, and that is, time will tell. This is a complete sentence. Time will tell. And you can say that when you're not sure what will happen in the future, but something will be revealed in time. We will know the answer in the future, but we don't know it now. Time will tell. At the very end of today's discussion, about Amazon's shiny new toy, a $4 billion company called One Medical, I speculated on what Amazon might do with the company. Some patients are worried that Amazon will find a way to raid their data and use their private doctor visits to sell them more things on Amazon.com. I'm not that cynical. I think Amazon is making a push into services. They've pretty much conquered online retail, at least in the US. Why not bring a little of the Amazon magic into health services? It's a huge market that could use some innovation. So who will be right? Will we find creepy ads on our smart speakers curiously related to our recent doctor visit? Or will Amazon find a way to use its scale to bring a good patient experience to more people? What will happen? I don't know. Time will tell. Time will tell. The answer will be revealed in time. We often use this expression with things that are out of our personal control. It seems that people have gone back to their old pre-COVID shopping and travel habits. People are even taking cruises again. But there's one place Americans haven't gone back to, and that's the office, at least not in big cities. Will office workers in New York, San Francisco, Chicago, Boston, and other cities go back into downtown offices like they once did? Time will tell. You can also say, only time will tell. If you say this, you mean it's impossible to predict. You might remember from lesson 247 that oil was discovered off the coast of the small South American country of Guyana. And I wondered if Guyana would use that oil wealth to become like Norway or like Venezuela. Both are rich in energy. Norway has managed it well and shares the proceeds with its citizens. Venezuela did the opposite. So, will Guyana use the wealth from its offshore oil to provide for its future, or waste it on cronyism and corruption a la Venezuela? It's impossible to say. Only time will tell. It's Monday, so we have a quote of the week for you. It's by the management guru Stephen Covey. He wrote an absurdly famous book called The 7 Habits of Highly Effective People. Personally, I couldn't get through it. I thought it was mostly fluff. But that's just me. The book has sold 20 million copies. Anyway, he does make an interesting point about communication. He says the biggest communication problem is we don't listen to understand. We listen to reply. And I think that's very true. So often, when people listen, they're not thinking deeply about what's being said. They're thinking only of how to reply, what they're going to say next. But if you determine a reply before the other person has finished a thought, then you're not going to communicate well. So you have my permission to skip the book, but do think about this quote from Stephen Covey. The biggest communication problem is we don't listen to understand, we listen to reply. Now, you all don't fall into that trap here because there's no easy way to reply to a podcast or a lesson like this. Until now, when you go to plainenglish.com/500, you can be the ones to finally talk to me on video, no less. And that's because JR and I are putting together a video to celebrate 500 lessons together, and you can be on that video. Here's how it works. Go to plainenglish.com/500, 500. Click the button that says record a video, and then just follow the prompts. It's 3 questions, and your video answers to the 3 questions will go into the final product. JR is standing by, ready to review, edit, and compile your responses so we can be ready before lesson 500. Now look, this is already $4.94, so if you haven't been part of the video yet, just go to plainenglish.com/500, 500. It will all be clear. Follow the steps, record yourself, and press submit. It really is so easy, and it would help us celebrate a huge milestone. I can't wait to see all your smiling faces on video, so check it out now. You can do it from your phone, plainenglish.com/500, and we'll see you on Thursday for number 495.